The rate of late stage diagnosis in our state is far too high. It's too high for people over the age of 50, and it's far too high for those under the age of 50. And we need to address that. The Fifty HealthCheck Program is a CDC-funded colorectal cancer screening program. Now, we pay for the screening for uninsured patients in Arizona. We use a FIT test, which is a fecal occult blood test, and it's a very technical test now. It's not like the old GUAIAC test. It's greatly improved. That's the first level of screening, and then the second level is a colonoscopy.
Okay.
If the fecal occult test is positive, then we move on to the colonoscopy.
One of the most important parts about the colonoscopy is fully understanding the preparation that you need to go through before the colonoscopy. The most important part of a colonoscopy is being cleansed the evening, night, or even early morning before the test. And the preparation selection will be between you and your physician, but specifically the whole day before you're on clear liquids, and then the night before you'll do a preparation to be cleansed. And then after being prepared for the procedure and meeting with the physician, you'll then be taken back to a procedure room. And then in that procedure room is where the colonoscopy would be performed. You'll be given medicine, your vital signs will be monitored on a continual basis, and then in about 20 minutes after a colonoscopy is completed and all the paperwork is done, then you'll be in recovery.
So it's a good exam, it's a good screening tool. And these nightmare scenarios of getting a perforation or having a problem like that, they're rare. They're exceptionally rare. If they weren't rare, we wouldn't be recommending this as a screening. It would be, it wouldn't be recommended as a screening procedure because it wouldn't be safe. But it is a very rare event, and it's a very safe thing to do.
I was kind of noticing some more abdominal pain. Okay, well, it's irritable bowel, you know, we're good. So I let that go for a few months. And finally, it was getting a little bit worse, so I actually called my doctor, made an appointment, didn't try to get in right away because I didn't think anything, you know, I'm sure I just need to go back on my medication because that had gone off when I became pregnant. The pain just got more and more intense. So I called my husband in Washington. He said, go to the hospital. So I'm bouting with, do I go? Do I not go? Because I don't know how long I'm going to be there. I'm still thinking in my mind irritable bowel. I can't imagine anything else that it would be. Ulcer, I mean, you know, just something that they can treat or you can adjust from your diet.
I was having some minor stomach disturbances, and I decided, you know, I can't keep dealing with this. So I decided to try to get into somebody that day, and I couldn't. And I thought this isn't something I should ignore, so I went into an ER, and I sat there for a very long time, 6 hours or so before I was seen. And they indicated at that time it sounded like I might have a case of colitis or something of that nature, but thought we should do a CT scan just to be sure.
The next day, the surgeon came in and had said, my colon intussuscepted. Okay, I'm still not worried. We can fix this, you know, okay, great. And then he proceeds to tell me, I can't believe I'm telling you this because I'm sitting in this hospital bed at 35 years old, healthy, no high risk, no red flags. He says, most likely it's colon cancer.
And so I was very shocked when a young doctor came in and told me that it appeared that I had cancer and that there seemed to be a large mass in my colon. And they'd also observed some spots on my lungs and were nervous that it had already advanced. And so they did some tests and sure enough confirmed that I had stage 4 rectal cancer at this point.
You know your body better than anybody else. And if you're eating the right foods and doing the right things and having, you know, exercising every day, you're healthy and there's just something a little bit off. You should go in and ask your primary care to refer you for a colonoscopy.
There are people that have symptoms already in the community. Symptoms they've been living with, symptoms they've been ignoring or trying to ignore, such as blood in the stool, irregular bowel movements, that sort of thing, pain in the abdomen, bloating.
So I think that it's important that we not let embarrassment or concern of embarrassment result in unnecessary pain, suffering, and even death.
If someone has symptoms, get screened. If you don't have insurance, that's not an excuse. Go to fit@50healthcheck.org and look up the program. It provides the phone numbers for where to call to set up an appointment.